Hi, it's Allison Harris with Imagine Insurance Advisors. We're going to talk today about our Medicare Plan Finder tool. So I'm going to go ahead and share my screen. You got this document, or you can request it from us and we'll send it to you. This is our Plan Finder tool guide. First thing I want you to know is very important is that you read your annual notice of change, the ANOC, annual notice of change that you get every September. Your insurance company is required to send it to you by September 30th. Read it. I can't articulate enough. Premiums change, co-pays change, a lot of things can change in plans from year to year. And if you don't make any changes, then your plan will look exactly the way it does for next year. So read your annual notice of change. It's very important. If you don't get one, call your insurance company and have them send it to you. So we suggest that people have a Medicare.gov account. If you take more than 5 medications, we want you to have one so that we can easily save your list of medications and come back to it from year to year, and you can update it. The purpose of this training and our guide is to show you how to do that yourself if you want to. But don't forget, we are always here for you if you need assistance, and we're always here to support you. Okay, so there's a couple of things that you can do on the Medicare.gov account. At the end of our document, we talk about some of those things. You can look at your claim information. You can create authorized representatives and those kind of things. Print off your ID card, get your drug plan information and everything else. But the meat of what we're talking about today is the Plan Finder Tool Guide. So what we're going to kind of do, I don't mean to make you dizzy with this, is we're going to kind of walk through this guide a little bit as we go through here. So I want to get it to a plate where I can come back to it later. So we're going to go ahead and we're going to go to the Medicare.gov. Make sure you're at Medicare.gov. That's the official government one, not Medicare.com or Medicare.org. It's Medicare.gov. You can either log in and click here to log in, or you can click on Create an Account. If you don't have an account, you can just click on Create Account Now with your Medicare number and the stuff we have in our guide. It's very simple to create one. If you go in to create one and you find that you already have one, call us because we might have created one for you in years past. So, but it's really easy to do that. If you forget your password or something, it's very easy to recover that as well. So I'm going to log into an account here, and you can see what happens when you log in. First of all, it'll tell you what your current plan is. Okay, and then if you click on the little person up here in the corner, you can click on your name. You can quickly jump to another number of different things. We're not going to do that here because this is a personal account for someone. It's my sister. I have her permission. But you can manage your account and add representatives. You can print your ID card. You can view your claims. So for our purposes here, and during the annual enrollment period, we call it AEP, we're going to go and we're going to evaluate coverage. So we're going to preview the 2022 plans. Okay, so it again tells you who your current plan is. And there's two ways you can look at this. You can look at Medicare Advantage plans, or you can look at Part D drug plans. If you have a Medicare Advantage plan, you'll click on a Medicare Advantage plan. If you have a Medicare supplement and a drug plan, you only really care about the drug coverage here. And it's very easy to toggle at the end between these. So I'm going to click prescription drug plan and next. Now, this is not what this person takes at all. We have tromped around in this many times, but we've put in examples of a list of medications that we want to go over with you. So if your list has drugs in it, it's probably because we put them there in the past or you put them there. If you don't have any drugs listed here, you can click on this recently filled drugs, and that will bring up the drugs that you've taken and had filled recently in the last 12 months, and you can click on those and it will add it to your list for you. Okay, so if we want to add another drug, let me see. So let's talk about these first. Okay, so first of all, when you add drugs from the list of previously filled drugs, you need to double check the strength that you're taking, the quantity, and how often you get it filled, because sometimes when things transfer over, things like a shampoo or a lotion or something like that, it might come through with a quantity of 118 because it's 118 milliliters. Well, you don't get a shampoo 118 times a month. I mean, you can't even wash your hair that much. So if you want to, so you can edit this. You just click on Edit Drug, and you can see it's very important. I cannot impress upon you enough that you have a list of your medications in front of you. Have the bottles in front of you when you do this, because you want to make sure that you're picking the right thing. So this clobetasol, it comes in a cream, it comes in a foam, it comes in a gel, it comes in a liquid, a lotion, an ointment, a solution. It comes in all different kinds of things. So you want to make sure you're picking the right one. So we're doing the shampoo. And here's the thing. I get this filled like maybe 4 times a year. If you put it in for once every 3 months, which you would think, oh, well, that would make sense, it's not going to calculate it out correctly. It's going to assume that you get one every month for 3 months. So when you pick something that you take rather infrequently, either put it in for once every 6 months or once every 12 months. Okay, because that'll show you that it's covered and what the copay is going to be. Then you just click Update Drug. Now, something else to be aware of is, do you take something every 3 months or every month? So if you get this prescription filled every 3 months, you don't want to put in 30 because it's once a day, so that's 30. 3 months, 3 times 30 is 90. Likewise, if you take something twice a day, that's 60 a month times 3 months is 180. So you want to make sure you got your math and everything here. You can always look at your bottle and see how they do it. Now, if you get something filled every 2 months, let's say I get 60 of these every 2 months. When you do something every 2 months, some plans don't calculate correctly, or they'll say this is not covered for the way that you get this filled, and it's going to show you a really high cost. So if you get something filled every 2 months, when you put your information in here, it's probably not going to come up correctly. So either put it in for every month or every 3 months. So I'm going to go 30 every month. Now, I'm going to talk a little bit about inhalers because a lot of people in the Ohio Valley use inhalers. So this is a generic inhaler. And first, I'm going to go ahead and take it off. So let's say I take an inhaler. So I'm going to go in, and let's say I use Ventolin. Okay, did you see what happened? When I started typing the word, it started to give me solution or options. So and when I see the one that I take, I can just click on that. Now it'll tell me, hey, there's a generic. Do you want to use the generic instead? In most cases, you will say, of course I want to take the generic one. But inhalers and insulin are a little bit different. You don't necessarily want to put the generic on there because not all companies will cover the generic. They'll cover the brand, but maybe not the generic. This is especially true for Advair, Combivent, some of those more expensive kind of inhalers. They will cover the brand drug, but not the generic. So if you add the generic and you go back and it shows that like no one's covering it or your costs are really high or something, go back and add the brand drug and see if that makes a difference. Sometimes you have to go back and forth. So I'm going to say, let's go ahead and add the generic. Okay, so when I click this little drop down, again, very important to have your stuff in front of you because, oh my gosh, there's 3 that look exactly the same. There's a nebulizer solution, there's a tablet, there's a syrup. So that's why it's also very important to have your list of medications. But if I take this one, it's an 18-gram inhaler. I pick this one, it's an 8.5-gram inhaler. And if I pick this one, it's a 6.7-gram inhaler. Well, why are they so different? It's because on the generic and in our little guide here, you have ProAir, Ventolin, and Proventol. So we have the different grams for the different ones. But they're all pretty interchangeable is our understanding. We got no medical training at all, but we work with a lot of people and they tell us, oh, I can use ProAir instead of Ventolin. I can use Ventolin instead of Proventil. So this kind of tells you what they are if you're going to go pick one. So I'm just going to go ahead and I'm going to take this first one, and I use one of those a month. So I'm going to add it to my list. Okay, so we know how to edit a drug. The other thing, and the reason you want your bottles in front of you is there's capsules and tablets. That's why the form we have you fill out asks, do you take the tablet or the capsule? Because sometimes it can make a big difference. Sometimes it doesn't, but on this particular drug, everybody takes the tablet, but the capsule isn't covered by anyone. So we're just going to go ahead and add the tablet. The other thing to be aware of is if you take insulin, insulin comes in pens or bottles. Okay, so oftentimes on our forms you'll see pens or bottles. People tell me I take 18 units in the morning and 35 units at night. That means nothing to me. That means absolutely nothing to me. So you have to tell me, do you use bottles or pens? And then how many of those do you use a month? So if you use 5 pens a month, this comes in a package of 5. You don't want to be putting 5 here because 5 times 5 is, we know from early math, 25. So I want only 1 box of that every month because it comes in a package of 5 already. Okay, so be aware when it's sold in a package of a number of them that you're doing your math to make sure you're not getting too many. If you get too many, what you'll find is at the end you'll see like a cost of $4,000 for insulin, and you'll be like, first of all, you'll probably have a stroke, and then you'll be like, something's wrong. That's usually what we find is the quantities and the frequencies are wrong when people have a big thing like that. The other reason that you want to have your bottles in front of you is, let me bring up this drug, venlafaxine. Okay, it comes in an extended release, it comes in not extended release, and then it comes in the 24-hour extended release, tablets and capsules. You'll find that on this particular drug, a lot of times the tablets are covered, but the capsules aren't. So you want to watch for that and that's again why you want to make sure that you have your bottle in front of you. And I use 90 every 3 months. Okay, actually I think it's the capsule that's covered. So I'm going to go 90 every 3 months. So that's why it's important to have your medications in front of you. Double check the quantities, double check the frequencies, double check your dosage amounts. Okay, so when you got your list done, then you come through here and you say, I'm done adding my drugs. Then you have a chance to add pharmacies. So I'm going to go ahead and if you've been in here before like we have, your pharmacies are on there. And there's nothing you need to do. You can just click on See Plans. But if you want to add another pharmacy, you just click on Add Pharmacy, and it'll bring up pharmacies in the area. Well, I don't see Walmart on here. Well, that's because I'm only looking at a distance of 1 mile. So you might need to change the distance to like 10 miles in order to find your pharmacy. So, you can go to the next page. Well, I don't want to keep paging through these. So you can just type in Walmart, find pharmacy, and then it'll find the Walmarts. You just can pick one. You don't have to pick the exact one that you use. Any Walmart pharmacy or Kroger or CVS or Walgreens or whatever is fine. You don't have to say, oh, but I go to this one at the Lewis Center. That doesn't matter, okay? It doesn't matter. You just pick Walmart. And then when you're done with that, you're going to click on Done. This will show you, it says your next plan. This is the way your plan will look next year. Okay, the other thing to be aware, it defaults to looking at 2022 plans. If you were wanting to look at something for this year, you need to click on this to show the 2021 plans, and then it'll show you the prices for 2021. But you want to make sure you're in 2022, because if you go base your decision on this year's plans, you're going to be really unhappy and really surprised when the time comes to use your plan, because the information oh gosh, I was going to sneeze, is going to be all wrong. Okay, so it'll say your next plan. This is the way my plan looks for next year. Okay, so this number right here, this retail pharmacy total drug and premium cost, is how much your drugs, your premium, and your deductible are going to be for the whole year. This is how we evaluate plans. And when I tell you I can save you $300, it's because I'm looking at this number. The Medicare website does this calculation for me. So let's get into the meat and potatoes of this. Okay, so plan details. This will tell you this is my monthly premium. This is my deductible. Okay, don't be scared by the $480. Most plans, unless they're kind of expensive, have a deductible, but many plans will waive the deductible for generic drugs, and I'll show you a way to determine how that is. Okay, so then it tells me, okay, out of all the pharmacies that I picked, which ones are preferred and which ones are standard. If I say, well, if let's say I picked all ones that were standard and I'm like, well, I want to find one that's a preferred pharmacy because my copays are going to be lower, you can click here on change pharmacies. And now when I go back to the pharmacies, because I'm in the detail for a plan, it will show me the ones that are preferred. So you always want to stick with a preferred pharmacy because the copays are lower at a preferred pharmacy. Then you can change. You can either take one off, you can add one in. Let's just take off mail order. And then you click done. Okay, so it brings me back here. Okay, something I learned the other day is, let's say you take a really expensive medication like Xarelto. You can click this on this, see if there's help for lower cost drugs. And this takes you to ways to lower your costs. Go to the third one, the Pharmaceutical Assistance Program. Click on that. Then you type in your drug. Let's do Eliquis. Eliquis. Okay. And then it'll find programs. So, of course, there's a COVID program. And then they say, hey, if you've spent at least, if you have Part D and you spend at least 3% of your income in drug cost, we'll help you. And sometimes, like this particular one says, if your income is less than $54,000, I think, they'll give it to you free. So either call this number. You can click on this to go to the program website where you can apply for it online or print off a form. But it's really great that now they're showing you there's ways to get lower help. And if there's patient assistance programs, it gives you the contact information so you can call them or you can visit their website. Or you can go to the manufacturer's website. It'll usually say, if you have Part D, we're not going to help you. Call the number, because sometimes there are programs if you have more limited income, and limited income can be $50,000 to $80,000. So or if you spend a certain percentage of your income out in drug costs. So this is really key and a wonderful, wonderful thing that they've added to the website this year. Okay, so it shows me, okay, so there's a number of charts. I'm going to make this a little smaller. There's a number of charts in here that I think are stupid, in my personal opinion, are stupid. Okay, this one right here I think is stupid. It shows you at each pharmacy, what is your drug going to cost for the whole year? Well, I don't care how much one drug costs for the whole year, okay? This shows you, this chart I like. This chart shows you, when are you going to meet your deductible? Are you going to get to the donut hole? And are you going to get to the catastrophic level? So I like that because now I know when my costs are going to change. So remember, January, March, and July. This chart, okay, it's good for budgeting numbers, because I can see here in August, oh, look how my costs dropped down so much. That's because I'm at the catastrophic level. Oh, look here in March, my costs went up. Oh, that's because I got into the donut hole. And, of course, January is going to be big because I have that deductible. So this chart, I'm 50-50 on. Now, but where's all my costs? Well, you have to click on this little plus sign next to the pharmacy to get the detail for each drug. So you can see in deductible, how much am I going to pay? When I get after the deductible, what are my copays going to be? See how these drugs are zero in the deductible? That means that they cover generic drugs in the deductible and I don't have to meet the deductible. And then I can see once I get to the donut hole, my cost actually comes down a little bit. Some drugs like the Xarelto go up quite a bit. Some of them come down a little bit with the Zetia here. So, and the clobetasol shampoo comes down. But overall, my cost is going to actually come down a little bit. But some of these are going to be a little more expensive. And then, of course, when you get to the catastrophic, Christmas came, your drugs are super cheap, and you're really happy. The other thing you'll notice on this particular plan, my insulin here, this Novolog, $35, $35, $35. There are some plans that have an insulin savings program built into them. So what that means is your insulin in the deductible, the initial stage, and the donut hole is always $35. So if you take insulin, you want to make sure that you're on a plan where it's going to be $35. Now, not all plans cover all insulin. So it might cover Novolog on this one, but if you use Lantus, it might not cover the Lantus. So you're going to see the full price on that. You might need to change your insulin, which I know some people can do, or find a different plan. Okay, so it shows you the copays here at Kroger. It shows you the copays at Walmart. To get to more drug, this little plus sign is really important too, okay, because it tells you what are my copays going to be at a preferred pharmacy. So at a preferred pharmacy, my generic drugs are 0 and my other generic drugs are 4, but at a standard pharmacy, it's 8 and 15. 0 and 4 is a big difference from 8 and 15. So that's why you want to make sure that you're going to a preferred pharmacy. You can also see what the copay is for a 3-month supply at a preferred pharmacy. A lot of times it's 3 times the copay. Sometimes it'll be 0 for the generic drugs. It varies by company. And if your plan covers generic drugs in the donut hole, it would have what the copay is. Not too many of them do. You don't want to use a standard mail order pharmacy. You always want to use the mail order pharmacy for the plan that you're using. So, for example, WellCare uses CVS Caremark as their mail order pharmacy. Humana uses Humana Pharmacy. So if I had a Humana plan last year, I don't want to be going to Humana Pharmacy because you're not going to save any money. I want to change to the Caremark Pharmacy for WellCare if I have WellCare this year. Okay, so you always want to make sure that you're using the preferred mail order pharmacy for your plan. And we can tell you what that is. The annual notice of change or your welcome kit will tell you what that is, but we can also tell you what that is. Then it comes down here. This is important too. This chart I like too. It tells you, do they rate your drug as a generic, a brand, or what tier is it? Tiers being, what are you going to pay? If there's a yes in prior authorization or step therapy, that means that your doctor is going to need to call the plan to get that approved. So you might say, but I've got 3 refills left. It doesn't matter how many refills you have left. If it has prior authorization or step therapy, your doctor is going to have to call this particular plan, being in this example, WellCare, and get it approved. The approval usually lasts for an entire year. So if you were on Anthem last year and you got a prior approval done and a WellCare requires a prior authorization, your doctor is going to have to call WellCare to do that. On a step therapy, that means that you have to have tried a couple of lesser expensive drugs first before they're going to approve this one. And it's usually when it's a more expensive drug and there's a lot of other alternatives available. So you're going to have tried other things. The other thing you want to be aware of is there a quantity limit? And if you just click on this, it'll tell you, oh, if you take 5 a day on this, you're going to have the doctor call to get it approved because they're only going to allow 4 a day. The inhalers and stuff like that, those don't mean anything. If you're taking one inhaler, that's not going to be a problem. 30 for 30 days on this one. So if you're taking more than the quantity limit, you'll want to make sure that maybe look at the next best plan, see how much more it would cost you, and see if maybe they're going to cover the quantity that you want. So sometimes there's a little bit of an art to kind of not just picking the cheapest one. Then this tells you how you put your drugs in. So when I see a big spike here in the cost for the venlafaxine or for the metformin, remember it's because I'm getting a 3-month supply of that. And if you see some numbers that are really funky in the cost up here, it's probably excuse me, because your quantity limit is wrong or your frequency is wrong. So you can come back here to change drugs, go ahead and fix that, and then click Done Adding Drugs. Now, there are some drugs that are not covered by Medicare, okay? And that's vitamins, erectile dysfunction drugs, weight loss drugs, those kind of things. So even though you might take a prescription medication for vitamin D, you might want to see if there's a GoodRx coupon. So we talk about the GoodRx and GlickRx here in our document. GoodRx, pretty much everybody knows that. If you go to Medicare.gov, okay, you can just type in the drug. So I'm going to do the albuterol inhaler, okay, and it's going to say, okay, so I'm going to use the 18-gram one. Okay, and then you can sort this by lowest price. So the lowest price for this is $28.23 at Walgreens. So I can just click on this free coupon. I can print this off. I can take it to the pharmacy, and I can use this over and over again. Okay? Another alternative is GlickRx. We're finding that in sometimes the costs on GlickRx are less expensive. So it's an app that you use on your phone, and you want to use the group number GMRX191 when you install it, because it'll ask for you for a group number. And then I have it here on mine because I have a broker portal here, but you just put it's all on your phone, and it's an app on your phone. So if I go to this pricing tool, I'm going to type in albuterol, and then I'm going to say, well, I only need one of those, and then I'm going to find the lowest price, okay? So you can see on GoodRx, remember it was $28.23. Here on GlickRx, and you want to kind of double check both of them, $5.12. So that's a pretty significant difference. And what we're finding is GlickRx many times will be less expensive than GoodRx. So check both of them out and use the one that's going to be better for you. We like GlickRx because usually the prices are less expensive, and then GoodRx is starting to email clients saying, hey, we have this Health Now or whatever it's called that can help you with your Medicare options. You don't want to call that because, one, that's what we do for you. We know your stuff the best, and we're going to do what's always in your best interest, okay? So that's how you kind of read this stuff and what's important in here. Now, how do I know if my plan is going to be the best for next year? Well, you come down here and it'll start to sort these by the lowest drug and premium cost. So you can sort it by lowest monthly premium. You only want to do that if you don't take any meds, okay? Because then you just want the cheapest plan. But you don't necessarily want to sort it by the lowest drug deductible because most of them have a deductible. So the only ones that don't are the expensive plans. And again, most plans waive the deductible for generic drugs, so it doesn't usually matter too much if you have a deductible. So you want to make sure you're looking at lowest drug and premium costs. And it just so happens that my plan, because see, this is my plan next year, my plan came in number one. So that's a good thing. But let's look at like the second best plan. Okay, you can just click on add to compare, and then you click on compare up to 3. Then you click on compare. Now this will show you your current plan. Very helpful. Then this is where, when I tell you that I can save you money, this is how I determine that. I'm going to take 3516 and I'm going to subtract, which is the total cost at Kroger, I'm going to subtract 3202. So that's a $314 difference. So if you were in this SilverScript Smart RX, when I call you up and I say, hey, I can save you $314 for the year, do you want to change? You might say, sure, I'll do that. And so that's how I know I can save you money. Likewise, if you say I go to Walmart and I run this at Walmart, and then the plan that comes at best is the WellCare Value Script, I'm going to go add a preferred pharmacy so that I can tell you, hey, if you're willing to change to Kroger, I can save you $115 or $151 for the year. Are you willing to change? You might say, no, I love my Walmart pharmacist, no problem. Or you might say, for $151, sure, I'll change to Kroger because I shop there anyway. So that's why it's important to always go to a preferred pharmacy. But this is kind of a way to easily show you the difference between the plans. And then again, you can go click on the plan details, what we walked through on all of this, all the same for every plan, the way the layout is here, okay? How the drug coverage is, all that other stuff. So it's all pretty much the same here once you get into the detail of the plans, okay? So if you want to enroll in a plan after October 15th, there will be a little button here that says Enroll Now. Okay, so you could do that if you wanted to. But we would ask, and it's here in our document also, we kind of put everything in here, is that you can do that. But if you do that, we will not be able to be your agent, okay, because you've just enrolled on your own. So if you have problems getting a prior authorization, or they don't set you up on the bank draft, or something happens, we can't support you because you're not in our portal. We don't have your number. We are nothing to you. But if we're your agent, then we have a little bit more pull with the insurance company. Okay, so we can help you if it doesn't get set up on the bank draft. So if you want to change your plan, what we would ask is call us and say, hey, Allison, Madeline, I want this SilverScript Smart RX. And we'll be like, okay, well, we can either do an electronic application, we can email you the paperwork, you can come in, we can mail you the paperwork, however you want to do it. If you get really frustrated, we're still here for you. Okay, so we're not telling you to do our job. We're asking you to help us. But if you say, you know what, I think I've come up with the plan I want, do you agree with me? We can log into your portal and we can say, oh, do you really take 5 shampoo bottles a month? Because I changed the quantity here and now I'm not agreeing with your solution. Or I might say, yeah, I'm okay with that. Yeah, do you want me to help you with the enrollment stuff? So we are still here for you. If you got hopelessly lost and you're like, oh my God, Allison, I walked through your thing step by step and I still can't do it, we're still here to help you. You are always here to help you. Okay, so just know that we're giving you tools to empower yourself, but we are still here if you need us. Okay. So don't just click on that little enroll button. Call us. Let us continue to be your agent. Honestly, we make lunch money, but lunch money adds up for us. Okay, and it's a service that we provide that few, if any, other agents in the city, or in this industry do. No one does this as to the magnitude that we do. Okay, so you've also been looking at all these things on TV. Oh my God, what's all this new stuff to Medicare? What are all these benefits I'm not getting? Well, those are Medicare Advantage plans. And come to our series that we're going to have, or watch it on the blog, our Medicare Advantage plans. They work differently from just a prescription drug plan. These kind of plans, and you can jump over those to see what they look like. You just click on that. You can flip-flop between drug plans and Advantage plans. This will show you that, okay, so it shows me my drug plan, and again, it shows me what's going to be the next plan, the best Medicare Advantage plan for me, based solely on your medications. But Medicare Advantage plans have a medical component to them. So there's not a good, easy way to compare all of the copays and everything else for the medical stuff between these plans. Okay, it's really only for the drug component. The details here, very similar, exactly laid out the same, except at the top, you'll start to see copays because they have the medical component to it. So you'll see copays for a lot of this medical stuff. And then it gets down into what we're familiar with looking at the drug coverage and the copays, and all of that in the drug section is exactly the same. Okay, it's just that at the top it has a little bit more because it has some of the more common medical copays that are listed here as well. Okay, so if you want to look at a Medicare Advantage plan, don't call the 800 number on the TV. Okay, because one, they're somewhat deceptive. Two, those people don't live here in Kentucky. And three, they are not going to have your best interest at heart. Call us. If you want to do a Medicare Advantage plan, or you want to look at one, we can help. We can write every single one of them that's out there. We put together a lot of tools, and we spend a lot of time studying the different plans to know the nuances between them, what's good with one, bad with another. And then we can also look up all your doctors, because you never want to do one of these plans without looking up all of your doctors. I've had too many clients this year that called something on the TV or got a call from somebody and did a Medicare Advantage plan because they thought it was going to be really great, didn't understand that there's copays for everything, their doctors weren't looked up, their drugs weren't looked up, and then it was a nightmare. We were able to get those fixed by filing complaints with Medicare, but call us first. If you want to try these, we're more than happy to help you with this. Make sure you understand what you're doing. Okay, but we'll talk more about that in our next webinar that we're going to have. So that's pretty much how you go about kind of evaluating your coverage, comparing the different plans, and everything else. So if you have any questions, feel free to call us. Our contact information is everywhere on everything we send out, either Madeline or myself. Both of us are very busy meeting with clients or talking with clients on the phone, so you will probably have to leave a message, but we do return every phone call. It may take us a day or two, but we do return every phone call. And we ask, this is our extremely busy time of the year. I'm getting 30 calls a day or more, phone calls a day, and then even more emails. So we ask that you please be patient. We have a very efficient process that we have for this. And we ask that you respect it. It works. It enables us to help as many people as possible in this short period of time. But be patient with us. If you sent in your drug list, you're in our process. If you want to call to make sure we have it, great. If you're going to be leaving and you're not going to be here back by December 1st, make sure you let us know we're leaving and we're not going to be back by the deadline. So, can you pull mine and run it early? But please don't abuse that, okay? But we are here to help you. We do get to everybody. We do work very long hours, very hard days. So just please give us a little bit of patience because we do our best, and we do our best for you, and we don't want to give you any less time than we give anybody else. So, we're not going to rush our conversations with you. We want to make sure that we're answering all your questions and you're getting all your information. Okay? So we really appreciate your business. We hope that you appreciate what we do for you. And I just want to say thanks for watching. You can watch it over and over if it puts you to sleep. And come back to our blog in the next couple weeks, because we'll have a couple more videos up there as well. Thank you and have a wonderful day. The deadline is December 7th. December 7th. So if you want a review, call soon. Thanks. Bye.